I have seen how frustrating it is for parents when they're trying to teach their autistic child how to wait without a clear strategy. That's why today I want to share with you the most important principle that I use with the families that I work with. One that doesn't require carrying a timer or printing out token systems so that you can teach your child how to wait while having fun with them. Hi, I'm Sergio. I'm an occupational therapist, and my wife Rosa is a speech therapist. We run a private practice in San Antonio, Texas, where 80% of the kids that we work with have a diagnosis of autism. Our goal is to support motivated parents with kids with autism in finding therapy services and courses that will help their child become emotionally, mentally, and physically stronger. All the parents that I have worked with love their kids, but they all share one common challenge, and that is how can they take care of their home or themselves if their kid cries every time they have to step away? And we're talking about kids that are older than 3 years old, developmentally. By teaching kids how to wait, the parents that I work with have found time to take care of themselves and their home, while at the same time their kids have learned that waiting can also be fun if done correctly. Now, if the goal is to teach kids how to be patient, what is the definition of patience? Patience means the ability of accepting or tolerating a delay without getting upset. Now, my most important strategy for teaching kids how to wait and be patient is to do something else while we wait. But Sergio, that is so simple. Exactly. I used to overcomplicate things. I will carry timers with me, print out token systems, and they're just not convenient or realistic. And what happens if I teach strategies that are not convenient for the parents? They're less likely to do them. And it's not their fault. They're busy. Also, let's be honest, when you and I are waiting, we figure out something else to do in the meantime. Think about when you have to wait in line or that you're stuck in traffic. We figure out something else to do in the meantime. We're not just waiting there without doing anything. Now let's dive into the success stories of my patients and I will let you know what to avoid. That way, you can teach your kids how to wait. The parents that I work with use my simple strategy to achieve 6 key goals. Waiting so that mom can wash the dishes, sharing toys, decreasing screen time, waiting for our food to be ready, letting mom and dad have dinner together, and waiting before we play with a new game. A 3-year-old struggled waiting for mom whenever she had to wash the dishes. And instead of printing a token system, we lined up all the dishes that she needed to wash and we started counting them as she was washing them. The reason we did this is because my patient loves to count. The same patient also struggled to let go of his iPad because mom wanted to decrease the screen time he gets. And instead of just removing the iPad and letting him figure out how to entertain himself, we mindfully created multiple games that he likes. That way mom could bond with him through play. A different patient had a hard time waiting while sharing his toys. And he loves this animal set and for me to make animal sounds. So I decided to make a story making animal sounds. I will grab a different animal that he wasn't playing with to get his attention. And then I will ask him for the animal that he was playing with so I can continue the story. In this scenario, my patient learned how to wait while being entertained by my story. A new patient had a hard time waiting for her food, especially when mom was baking her favorite muffins. In this scenario, instead of using a timer, we decided to sing songs. So in this scenario, waiting became an activity of singing 2 to 3 songs and then we will get our muffins. And this same patient also had a hard time waiting whenever mom and dad wanted to have dinner together. And knowing that she loves to sing, specifically Taylor Swift songs, mom and dad decided to set up a Taylor Swift concert in the living room. We're talking about lights, microphone, everything. Another patient had a hard time waiting before playing a new game. You see, whenever she had a new idea about a new game to play with mom, it had to happen right away. So if mom needed to do something around the house, she literally had to stop and play that game. And this patient loves to be around mom. So we double down on that. How do we do that? We ask her for help. Mom would say, "Hey Lily, can you help me super quick with the towels?" And she loved it. She didn't like the part of folding the towels. No one likes that. But she loved helping mom. And as soon as they were done, they will go back and play that new game that she wanted to play. Now, here are 3 things to consider before you start teaching your kid how to wait. Start at home. I find it to be easier and less stressful than doing it out in the community. Also, if your kid learns how to wait at home, it will be much easier to practice out in the community. Next, set a goal. I will say just 15 minutes. Honestly, it's more about the frequency than how much time you do it. Third, I would suggest to skip using the word wait if your kid already has a negative association to that word. Meaning, the moment you say wait, they start crying. And honestly, most of the time, I don't even use the word wait. That means instead of saying like, "Oh, we have to wait," I'll just tell them like, "Oh, we need to wash 5 dishes before we go play that game." And here are 3 things I avoid doing when I'm teaching my patients how to wait. I do not present new games when I'm teaching my patients how to wait. I have to use games that they like already. Think about my patient that likes counting numbers. I have to involve counting numbers somewhere while we're waiting, instead of asking him to start coloring. He's not really that interested in coloring, so why present it at this time? Now, don't get me wrong, there's a separate time and place for us to explore new games. The second one for me is do not rush the process. Kids are way more successful when you take it smaller but progressive steps. Same patient that we were talking about earlier. Instead of doing 10 dishes, we started with one dish, counting to 5, all the way to 10 dishes. Take it smaller but progressive steps. Make your kid feel stronger and more confident. And last one, and the most important one, is that I do not ignore a patient that starts crying. This is a new skill and they're going to be confused, but we still have to make it as easy as possible for them to understand this new skill of waiting. If my patient starts crying, I'll try to bring the attention to the game that we're trying to play. But sometimes I do need to take a step back because it's too much for them, and that's okay. I'll stop the activity and help them calm themselves down. After that, I can make adjustments to the plan. I can make the steps or the expectations smaller or change the game overall. At the end, teaching kids how to wait doesn't have to be complicated or frustrating. If we focus on what your kid likes and double down on that, while we take smaller but progressive steps, we will make learning how to wait a better experience for everyone. If you found this video helpful, don't forget to subscribe. Bye.